5 common medications that could wreck your liver. Welcome back to our Healthy Care channel. Today, we're diving into an incredibly important topic that could save your liver and your life: 5 popular drugs that cause liver damage. Many of us reach for these common medications without a second thought, whether to shake off a headache, manage pain, or reduce inflammation. But did you know that even everyday drugs can pose serious risks to your liver if not used cautiously? In this video, we'll uncover the hidden dangers of 5 widely used medications, explore why they can harm your liver, and provide you with crucial tips on how to use them safely. Whether you're taking these drugs currently or just want to stay informed, stick around to ensure you're protecting your liver health effectively. Don't forget to hit the like button if you find today's video informative, and subscribe to our channel for more health insights and tips. Let's jump right into it and start safeguarding our liver today. 1. Amiodarone. Amiodarone is commonly prescribed to manage irregular heart rhythms, but it comes with concerns for liver health. Elevated liver function tests, LFTs, are seen in up to half of the patients on long-term amiodarone therapy. While these elevated levels typically do not lead to serious health issues, about 1% of users may experience significant liver damage. In light of these risks, the FDA has issued its highest alert, a boxed warning for amiodarone, highlighting the potential severe impact on liver health. This warning serves to inform both patients and healthcare providers about the serious risks associated with its use. For those prescribed amiodarone, regular monitoring of liver function is crucial. This entails frequent LFTs to ensure that any necessary adjustments to the treatment can be made promptly. The risk of liver injury is particularly higher in individuals who take the medication at higher doses or over extended periods. Being proactive in monitoring can help manage these risks effectively. 2. Amoxicillin-clavulanate. Amoxicillin-clavulanate, often known by the brand name Clavulin, is a widely used antibiotic combination prescribed for a variety of bacterial infections, including pneumonia, urinary tract infections, and sinusitis. Have you ever been prescribed this medication? Share your experiences in the comments below. Surprisingly, after paracetamol, amoxicillin-clavulanate ranks as one of the top medications associated with liver damage. This combination pairs an antibiotic with a substance designed to inhibit bacterial resistance, enhancing its effectiveness. However, it's believed to potentially cause liver damage through an allergic reaction, although the exact mechanism is not fully understood. It's important to be aware that other drugs frequently linked to liver injury include antibiotics such as isoniazid, trimethoprim sulfamethoxazole, erythromycin, nitrofurantoin, minocycline, and the antifungal medication ketoconazole. If you are taking amoxicillin-clavulanate or any similar medications, regular monitoring of liver function by a healthcare provider is advised to catch any potential liver damage early. 3. Diclofenac. Diclofenac, marketed under names like Cataflam, is a nonsteroidal anti-inflammatory drug, NSAID, widely used to alleviate pain from various conditions including arthritis. While effective, its use raises concerns particularly when taken orally, as opposed to its topical forms like gels, creams, and patches, which pose a lower risk of liver injury due to lesser absorption into the body. For those using oral diclofenac, the risk of severe liver injury increases with chronic daily use, especially in individuals predisposed to liver complications. As with many NSAIDs, diclofenac can cause liver damage that might not immediately manifest symptoms, but can lead to significant abnormalities in liver function tests, LFTs. These tests measure liver enzymes, and elevated levels can indicate liver injury. Regular monitoring through blood tests conducted by healthcare professionals is crucial to detecting these signs early. Although serious liver damage from diclofenac is rare, the risk is heightened in certain populations, particularly women, those on higher dosages, and extended use typically beyond 4 weeks. 4. Tylenol. Tylenol, a common over-the-counter medication, contains acetaminophen, a pain reliever and fever reducer that is generally safe for the liver when used appropriately and within recommended doses. However, it's important to recognize that liver damage can occur if Tylenol is taken in large doses or used chronically. A single excessive dose of Tylenol can lead to acute liver damage, a serious condition known as Tylenol overdose, which requires immediate medical attention. If you suspect an overdose, it's critical to contact a poison control center or seek emergency medical care without delay. Frequent use of Tylenol, or taking it over an extended period, increases the risk of liver damage, especially in individuals with pre-existing liver conditions, chronic illnesses, or alcohol use disorders. To reduce the risk of liver issues related to Tylenol, consider the following precautions. Never exceed the maximum recommended daily dosage of 4,000 milligrams. Avoid alcohol consumption while taking Tylenol. Check if acetaminophen is an ingredient in other medications you're taking, including over-the-counter and prescription pain relievers, to prevent unintentional multiple dosages. Common cold and flu remedies often contain acetaminophen as well. Acetaminophen can harm the liver by producing a toxic byproduct during its metabolism. This metabolite can accumulate over time, leading to structural changes in the liver and impairing its normal function. Drug-induced hepatitis, a condition where the liver becomes inflamed due to the effects of medications, often results from excessive or inappropriate use of medications known to be harsh on the liver, such as acetaminophen or nimesulide. Other pain relievers, including Advil, ibuprofen, Voltaren, Diclofenac, and Cilindac, are also associated with liver injury. It's an ironic reality that the medications we rely on to alleviate pain and discomfort can pose such significant risks to our liver health. The liver plays a crucial role in metabolizing medications, neutralizing them to prevent accumulation in the body, which could potentially cause harm. However, this protective mechanism can paradoxically endanger the liver by producing toxic compounds in the process. Being aware of these risks and taking steps to use medications like Tylenol safely can help maintain your liver health and overall well-being. 5. Statins. Statins are among the most widely prescribed medications globally, renowned for their effectiveness in managing high cholesterol. Commonly known brands include simvastatin, Zocor, atorvastatin, Lipitor, and rosuvastatin. While statins are essential for many to control cholesterol levels, they do come with a potential risk of liver injury. The damage caused by statins is thought to result from either a toxic metabolite produced during their breakdown or an allergic reaction, although the precise mechanisms remain unclear. Instances of liver injury from statins like simvastatin are generally mild, and often reversible once the medication is discontinued under a healthcare provider's guidance. In many cases, patients may continue using the medication if the liver damage is not severe. However, in the event of a significant increase in liver enzymes, it might be necessary to switch to a different statin. Although liver issues related to statins are rare, they can occur, which is why healthcare providers often perform a liver enzyme test before starting the medication and shortly thereafter. Continuous monitoring is typically not required unless symptoms that may indicate liver damage appear. These symptoms include unusual fatigue, weakness, loss of appetite, upper stomach pain, dark urine, or yellowing of the skin or eyes. If you experience any of these symptoms while taking statins, it's crucial to contact your healthcare professional immediately. They can provide guidance on whether it's safe to continue the medication or if adjustments are necessary. Being proactive about monitoring can help balance the benefits of statins with the need to protect your liver health. Can supplements cause liver damage? Dietary supplements can indeed cause liver damage. Remarkably, studies have shown that supplements account for up to 20% of liver injury cases in the United States. This statistic underscores the importance of cautious use and understanding of the potential risks associated with dietary supplements. Supplements linked to liver damage. Bodybuilding supplements, products containing anabolic steroids, are particularly notorious for causing liver damage due to their potent and often harmful effects on liver function. Weight loss supplements, those containing green tea extract, have been implicated in several cases of liver injury, despite the health benefits often associated with green tea. High-dose vitamins, certain vitamins, like niacin, can cause liver damage when consumed in excessively high doses, particularly dosages reaching 3,000 mg per day over several months. Herbal products, supplements like ginseng and black cohosh, have also been reported to cause liver issues, highlighting that natural does not always mean safe. Multi-ingredient nutritional products, these can contain a mix of substances that might interact poorly or overload the liver. Given the potential risks, it is crucial to approach the use of dietary supplements with caution. Before starting any new supplement regimen, especially those involving high doses or long-term use, consulting with healthcare professionals is essential. This step is vital to ensure that the supplements will not adversely affect your health or interact negatively with other medications you may be taking. Early signs of liver damage from supplements. The liver is a resilient organ, capable of withstanding many forms of injury. However, when it is damaged by medications or supplements, it can deteriorate rapidly and fail within days. Recognizing the early signs of liver damage is critical and can include symptoms such as fatigue, weakness, loss of appetite, upper stomach pain, dark urine, or jaundice, yellowing of the skin or eyes. If you experience any of these symptoms while taking supplements, it is crucial to cease use immediately and consult a healthcare provider for an evaluation. Early detection and treatment are key to preventing more severe liver damage or failure. Liver damage from medications is a serious health issue that can escalate rapidly, sometimes with life-threatening consequences. It's essential to be aware of the symptoms and factors that contribute to drug-induced liver injury to ensure timely intervention and treatment. The progression of symptoms related to liver damage can vary but often includes early signs, nausea, vomiting, and mild abdominal pain. Progressive symptoms, severe abdominal pain, fever, diarrhea, dark urine, and jaundice, the yellowing of the skin and eyes, which indicates high bilirubin levels in the blood. Advanced stages, extreme fatigue, sleepiness, skin rashes, and pale or white-colored stools. In severe cases, symptoms may escalate to coma. If you experience any of these symptoms, it is critical to seek immediate medical attention. Bringing any medication boxes or lists of recently used drugs to your healthcare provider can be incredibly helpful in diagnosing and treating potential liver issues. The liver plays a crucial role in metabolizing and inactivating drugs, a process that is generally consistent across individuals. However, variations exist due to genetic differences, which can explain why some people are more sensitive to certain medications. These variations can lead to the liver producing toxic molecules as it attempts to process certain drugs. Additionally, some medications can trigger severe immune reactions that lead to liver damage. This underscores the importance of monitoring for any signs of liver injury, especially when taking medications known to potentially affect liver health. While this discussion highlights 5 particular medications known to cause liver damage, it is important to understand that other drugs may carry similar risks. To determine if the medications you are taking might pose a risk, consult the Adverse Effects section of the drug's leaflet. However, do not panic upon finding risks listed. Instead, maintain an open dialogue with your healthcare provider to address any medication-related concerns. Drug-induced liver injury, while serious, is relatively rare in the general population. Being informed and vigilant about the medications you take and their potential impact on your liver is crucial for maintaining good health. If you found this information helpful, please give it a thumbs up and consider sharing it with your loved ones. For more insights on health and lifestyle, subscribe to our channel and hit the notification bell to stay updated with our latest content. Stay informed and proactive about your health. Welcome back to our channel. Did you know that some common medications can increase the risk of liver damage? Have you ever wondered if the daily pill you take might be harming your liver health? Today's video will reveal surprising information about 10 common medications that can cause liver damage, according to recent studies. Let's explore what these medications are, understand the associated risks, and discover safer alternatives for treating conditions like pain, cholesterol, depression, and infections. This video will provide you with crucial insights that could change the way you approach medical treatment and protect your liver health. Stay tuned until the end because the 10th medication is the most dangerous, and many people take it without realizing the risks. You will be surprised by what you learn. 1. Methotrexate. Methotrexate is widely used to treat conditions such as rheumatoid arthritis and psoriasis, but it can cause liver toxicity, especially with long-term use. Methotrexate can lead to increased liver enzymes, such as ALT, alanine aminotransferase, and AST, aspartate aminotransferase, which are markers of liver damage. This can occur even at low doses commonly used in treating rheumatic diseases. Regular monitoring of liver enzyme levels is crucial for early detection of liver injury. Long-term use of methotrexate can increase the risk of liver fibrosis, a condition characterized by excessive fibrous tissue in the liver, potentially leading to cirrhosis. Regular liver function tests are essential to manage this risk effectively. This preventive measure helps mitigate some adverse effects associated with methotrexate therapy. For patients experiencing elevated liver enzymes or other signs of liver damage, reducing the dose of methotrexate or switching to alternative therapies may be necessary. 2. Acetaminophen, paracetamol. Acetaminophen, also known as paracetamol, is commonly used for pain relief and fever reduction. Although generally safe at recommended doses, excessive use or overdose can lead to severe liver damage, making it a leading cause of acute liver failure. Acetaminophen can be toxic to the liver, particularly when taken in high doses or combined with other products containing acetaminophen. This is because the liver metabolizes the drug, and high doses can deplete glutathione, a substance necessary to protect liver cells from damage. Overdose of acetaminophen is a major cause of acute liver failure, a life-threatening condition. Do not exceed the recommended dosage, typically not more than 4 grams, for 1,000 milligrams, per day for adults. Avoid simultaneous use with other acetaminophen-containing products. Many medications, including cold and fever remedies, also contain acetaminophen, so it's essential to check labels before use. If symptoms such as nausea, vomiting, abdominal pain, or jaundice occur, discontinue the medication and consult a healthcare provider immediately. The use of acetaminophen should be closely monitored, especially in individuals with liver issues or those who consume alcohol regularly. Don't forget to subscribe to our channel to get more helpful health information. 3. Allopurinol. Allopurinol, used to treat gout, can cause liver dysfunction. Regular liver function monitoring is crucial for those on long-term allopurinol therapy. Allopurinol can cause serious liver-related side effects, including elevated liver enzymes, hepatitis, and in rare cases, liver failure. This usually occurs due to the metabolism of the drug in the liver, leading to the accumulation of harmful metabolites. Some patients may experience allergic reactions to allopurinol, resulting in liver issues such as Stevens-Johnson syndrome and toxic epidermal necrolysis, both of which can cause severe liver damage. Symptoms include jaundice, fatigue, nausea, and abdominal pain. Studies have linked allopurinol to elevated levels of liver enzymes like ALT and AST, which indicate liver cell damage. Regular monitoring of these markers is necessary to detect any abnormalities early. To mitigate the risk of liver damage, patients should undergo regular liver function tests throughout their allopurinol treatment. Adjusting the dosage or discontinuing the medication may be necessary if signs of liver damage appear. Consult with your healthcare provider to ensure safe and effective treatment management. 4. Nitrofurantoin. Nitrofurantoin is an antibiotic commonly used to treat urinary tract infections. While effective in treating these infections, nitrofurantoin can also cause serious liver damage, particularly with long-term use or at high doses. Nitrofurantoin can cause liver-related issues ranging from mild hepatitis to severe liver damage, including cirrhosis. The hepatotoxic effects may be due to immune-mediated responses or the accumulation of toxic metabolites in the liver. Symptoms of liver damage from nitrofurantoin can include fatigue, nausea, abdominal pain, jaundice, yellowing of the skin and eyes, and elevated liver enzymes, ALT, AST. Jaundice is a distinctive sign of liver dysfunction, often related to the accumulation of bilirubin in the blood. These symptoms may appear after several weeks or months of medication use and can become more severe if not promptly addressed. In some cases, nitrofurantoin-induced liver damage is a result of an abnormal immune response, leading to autoimmune hepatitis. This condition involves the immune system attacking liver cells, causing inflammation and damage. It is a serious condition requiring immediate medical intervention to prevent long-term liver damage. 5. Amiodarone. Amiodarone is widely used to treat arrhythmias but has significant potential for liver toxicity, including leading to conditions such as cirrhosis. This medication can cause both reversible and irreversible liver damage, which is often exacerbated by prolonged use. Amiodarone has been linked to liver injury through its accumulation in the liver, which can lead to steatohepatitis and cirrhosis. This occurs because the drug inhibits mitochondrial beta-oxidation of fatty acids, causing fat accumulation in liver cells, which can progress to cirrhosis. The risk of developing cirrhosis increases with higher doses and prolonged use of the medication. The liver toxicity associated with amiodarone is believed to be due to the formation of Mallory-Denk bodies in hepatocytes, which indicate cellular damage. Amiodarone can also lead to phospholipidosis, where phospholipids accumulate in the liver cells, further contributing to liver damage. Patients using amiodarone may experience symptoms of liver dysfunction, including jaundice, fatigue, nausea, and elevated liver enzymes. In severe cases, this can progress to acute liver failure, particularly in patients with pre-existing liver conditions or other risk factors such as alcohol use or metabolic syndrome. 6. Tamoxifen. Tamoxifen is widely used for the treatment and prevention of breast cancer. While effective in reducing the risk of cancer recurrence, tamoxifen can have significant effects on liver health, potentially leading to serious complications. Tamoxifen can induce hepatic steatosis, commonly known as fatty liver disease. This condition involves the accumulation of fat in liver cells, which can potentially progress to non-alcoholic steatohepatitis, NASH, fibrosis, or even cirrhosis if not managed appropriately. The risk of developing fatty liver is particularly higher in patients with obesity, diabetes, or other metabolic conditions. Elevated liver enzymes such as ALT, alanine aminotransferase, and AST, aspartate aminotransferase, have been observed in patients undergoing tamoxifen therapy. These enzymes are markers of liver inflammation or damage, and their elevation indicates that the liver is under stress, potentially from the drug's hepatotoxic effects. In more severe cases, tamoxifen can lead to non-alcoholic steatohepatitis, NASH, a more aggressive form of fatty liver disease characterized by liver inflammation and cell damage. NASH can progress to fibrosis, cirrhosis, and increase the risk of liver cancer. 7. Valproic acid. Valproic acid, also known as valproate, is widely used for treating epilepsy and bipolar disorder. However, this medication carries significant risks for liver health, particularly in certain populations. Valproic acid is known to cause liver toxicity, with the risk being higher in children under the age of 2, patients with mitochondrial disorders, and those with a history of liver disease. The mechanism involves the disruption of mitochondrial function, leading to an accumulation of toxic metabolites that can damage liver cells. This can result in conditions ranging from mild elevations in liver enzymes to severe liver failure. Symptoms of valproic acid-induced liver toxicity can include jaundice, yellowing of the skin and eyes, fatigue, nausea, vomiting, abdominal pain, and unexplained bruising or bleeding. These symptoms can indicate serious liver damage, including fulminant hepatitis, which is a rapid and severe form of liver inflammation. These include infants and young children, particularly those with genetic metabolic disorders such as urea cycle disorders or mitochondrial diseases. Patients with these conditions may experience an exacerbated toxic effect due to an inability to adequately metabolize the drug. 8. Oral contraceptives. Oral contraceptives, particularly those containing high levels of estrogen, are widely used for birth control and other medical purposes. However, they can pose certain risks to liver health, which vary based on the formulation and dosage of the hormones used. Some oral contraceptives can lead to elevated levels of liver enzymes such as ALT, alanine aminotransferase, and AST, aspartate aminotransferase. These enzymes are markers of liver inflammation or damage. Elevated levels may indicate that the liver is under stress or has sustained damage, potentially leading to more serious conditions if not monitored and managed appropriately. In rare cases, oral contraceptives, especially those with higher estrogen content, have been associated with the development of hepatic adenomas. Although these tumors are generally non-cancerous, they can rupture or bleed, leading to serious health complications. Long-term use of oral contraceptives has been linked, though rarely, to an increased risk of hepatocellular carcinoma, liver cancer. Oral contraceptives can also cause cholestasis, a condition where the flow of bile from the liver is reduced or blocked, leading to symptoms such as jaundice, itching, and liver dysfunction. 9. Antidepressants. Certain antidepressants, particularly tricyclic antidepressants, TCAs, like amitriptyline, have been associated with hepatotoxic effects, which can lead to liver inflammation, cause liver enzyme elevations or damage. This hepatotoxicity may manifest as a range of liver conditions, from asymptomatic enzyme elevations to more severe liver inflammation, hepatitis, or even jaundice. The exact mechanism is not fully understood but is thought to involve direct hepatocyte toxicity or immune-mediated responses. Patients may experience symptoms such as fatigue, nausea, abdominal pain, and jaundice if they develop significant liver injury from TCAs. Monitoring liver function tests, LFTs, before and during treatment is crucial, especially in patients with pre-existing liver conditions or those taking other hepatotoxic medications. This monitoring helps detect early signs of liver dysfunction, allowing for timely intervention. The risk of liver damage may be higher in individuals with certain risk factors, including those with existing liver disease, alcohol use, obesity, or metabolic conditions such as diabetes. The elderly and those on long-term TCA therapy may also be at greater risk due to prolonged exposure and age-related decreases in liver function. 10. Herbal supplements. Herbal supplements, such as kava, comfrey, and certain Chinese herbs, are popular for their perceived natural benefits. However, these supplements can pose significant risks to liver health, particularly because they are not subject to the same rigorous testing as prescription medications. Kava is a popular herbal supplement used for its calming effects. However, it has been linked to severe liver toxicity, including hepatitis, cirrhosis, and liver failure. The hepatotoxicity of kava is thought to be related to cavalactones, its active compounds, which can cause mitochondrial dysfunction and oxidative stress in liver cells. Comfrey contains pyrrolizidine alkaloids, which are highly toxic to the liver. These compounds can lead to veno-occlusive disease, a condition where the small veins in the liver are blocked, leading to liver damage and potentially liver failure. Some traditional Chinese herbal medicines, such as those containing aristolochia or certain compounds from the genus Polygonum, have been associated with liver toxicity. Aristolochic acids, in particular, are nephrotoxic and hepatotoxic, potentially leading to acute liver injury, fibrosis, or even liver cancer. Unlike prescription medications, herbal supplements are not required to undergo rigorous clinical testing for safety and efficacy before being marketed. In this video, we've explored the potential liver-related risks associated with 10 commonly used medications, including both prescription drugs and herbal supplements. From acetaminophen and valproic acid to herbal remedies like kava and comfrey, these substances can cause a range of liver issues, including fatty liver disease, hepatitis, cirrhosis, and even liver cancer. It's crucial to understand that while these medications can be effective in treating various conditions, they must be used cautiously, especially in individuals with pre-existing liver conditions or those taking multiple medications. Regular liver function monitoring and consultation with healthcare providers are essential to ensure safe use and to detect early signs of liver damage. Remember, the liver is vital for detoxifying the body and maintaining overall health. Protecting your liver by being informed about the potential risks of medications is a key step in preventing severe complications, including liver cancer and liver failure. Thank you for watching, and don't forget to like, subscribe, and consult with your healthcare provider before making any changes to your medication regimen. Stay healthy and take care of your liver. Welcome back to our channel. We always aim to bring you important information about health and safety. Today, we're going to share a rather sad story that we think you need to be aware of. This is about the hidden dangers of a popular dietary supplement that many people use without knowing its potential harmful effects. Many people believe that dietary supplements, especially those advertised as natural, are always safe and beneficial for health. However, some dietary supplements may contain ingredients that are not well known or fully tested for safety. This is particularly dangerous when these products are used for a long time or not according to a doctor's guidance. One of the potential risks of using dietary supplements is serious harm to the liver and kidneys. The liver and kidneys are crucial organs in filtering toxins from the body, and when they are damaged, your overall health is at risk. Stay tuned to learn more about the hidden risks of dietary supplements and how to avoid them. Let's get started. 1. Case reports. This is a story about a man we will refer to as David, though that is not his real name. The story was originally reported by the BBC under the title, "Food Supplement Ruined My Liver." David had been using green tea extract supplements for a couple of months. During his son's graduation ceremony, his wife noticed a change in his appearance. She asked David if he felt all right, to which he replied that he felt fine. However, she pointed out that his face and eyes were yellow, indicating jaundice. Despite feeling well, David was experiencing serious health issues internally, which he was unaware of. After the ceremony, David visited the hospital, where extensive investigations were conducted to determine the cause of his liver problems. Initially, the doctors couldn't find a clear cause. However, upon further questioning, David revealed that he had been taking green tea extract supplements. This revelation led his liver specialist to suspect that the supplements were the cause of his liver damage. The situation worsened rapidly, with David's liver becoming severely damaged. The liver specialist informed him that he urgently needed a liver transplant within days. Fortunately, a suitable liver was found, and the transplant was successful. However, the damage extended beyond his liver, as his kidneys were also affected, necessitating dialysis and potentially a future kidney transplant. This case highlights the potential dangers of green tea extract supplements. Don't forget to subscribe to our channel to update the latest health information. To further illustrate this issue, we look at another case published in the Journal of Ethnopharmacology. In this case, a 63-year-old woman developed acute hepatitis after taking green tea extracts recommended by a cancer support group. A liver biopsy confirmed that the hepatitis was drug-induced, and other potential causes were ruled out. The good news is that after discontinuing the supplement and receiving medical treatment, she recovered. The study authors analyzed the green tea capsules and found no contaminants, only the active ingredients typically found in green tea. They concluded that concentrated herbal extracts from green tea might not be free of adverse effects in certain circumstances. Let's examine two specific cases to highlight the potential dangers associated with dietary supplements, particularly those containing green tea extract. The first case involves a 39-year-old woman who developed acute hepatitis after using a weight loss supplement. The primary ingredient in this supplement was green tea extract, which has been linked to liver toxicity in some cases. The woman initially presented with symptoms including abdominal pain, jaundice, and nausea. Upon her admission to the hospital, a thorough examination was conducted to rule out other common causes of hepatitis, such as hepatitis A, B, and C, all of which were excluded. Her blood tests showed that her liver enzymes, specifically ALT and AST, were elevated to levels 20 times higher than normal, indicating severe liver damage. This extreme elevation of liver enzymes suggested acute liver injury, possibly induced by the supplement. Following these findings, the supplement was immediately discontinued, and the woman underwent a liver biopsy. The biopsy revealed significant inflammation and necrosis, indicating that a substantial number of her liver cells had died. This diagnosis underscored the severe impact of the supplement on her liver health. After spending 2 weeks in the hospital receiving treatment, she fortunately made a full recovery. However, this case took an unexpected turn when, about a year later, the woman decided to resume using the same weight loss supplement. Unfortunately, she developed the same symptoms of acute hepatitis once again, including elevated liver enzymes and jaundice. This recurrence clearly demonstrated a direct correlation between the supplement and her liver damage. Despite the setback, she was able to make a full recovery after discontinuing the supplement for the second time. This case illustrates the potential dangers of dietary supplements, even those that are marketed as natural or beneficial. It also highlights the importance of being cautious with such products and consulting healthcare professionals before use. Supplements can have powerful biological effects, and in some cases, they can cause serious harm to vital organs like the liver. Another case involves a 27-year-old woman who developed hepatitis after using a weight loss supplement called hydroxycord. Within 4 to 5 weeks of starting the supplement, she experienced severe liver problems. This was evidenced by significantly elevated liver enzyme levels, particularly ALT and AST, which are key indicators of liver health. The high levels of these enzymes suggested acute liver damage. Her symptoms included jaundice, yellowing of the skin and eyes, fatigue, and abdominal pain, which led her to seek medical attention. Blood tests confirmed that her liver enzyme levels were alarmingly high, similar to those in the first case. This situation underscores the potential dangers associated with certain dietary supplements, especially those marketed for weight loss. This is especially important given the widespread availability and aggressive marketing of these products, which often downplay potential health risks. In both cases, the individuals faced serious health consequences that required immediate medical attention. The elevated liver enzymes indicated not just minor liver strain but potential long-term damage, which can lead to severe health issues if not addressed promptly. These incidents serve as a critical reminder of the importance of being informed and cautious about supplement use. 2. Effects on health. Green tea extract and its effects on health, especially liver and kidneys. Green tea extract, often promoted for its antioxidant properties and health benefits, contains a compound known as epigallocatechin gallate, EGCG. While EGCG can provide benefits in moderate amounts, its concentrated forms in dietary supplements can pose significant risks, particularly to the liver and kidneys. Effects on the liver. Acute hepatitis, one of the most serious issues related to the use of high doses of green tea extract, is acute hepatitis. This condition can lead to liver cell damage, with symptoms including fatigue, abdominal pain, jaundice, yellowing of the skin and eyes, and dark urine. These symptoms are indicative of serious liver issues requiring immediate medical intervention. Liver failure. In more severe cases, liver damage can progress to liver failure, a life-threatening condition where the liver loses its ability to perform essential functions, such as detoxifying the blood, producing proteins and bile, and regulating blood sugar and fats. This procedure is complex, expensive, and carries significant risks, including organ rejection, infection, and the need for lifelong monitoring. Effects on the kidneys. Nephritis. Green tea extract can lead to nephritis, causing inflammation in the kidney's blood filtering structures. This can reduce the kidney's filtering ability, making it difficult to remove waste from the body. Symptoms may include lower back pain, swelling, edema, and high blood pressure. Kidney failure. In severe cases, kidney damage can progress to kidney failure, a condition where the kidneys cannot effectively remove waste from the blood. This leads to the accumulation of toxins in the body, causing symptoms such as fatigue, weakness, nausea, and potentially heart problems. As kidney failure advances, patients may require dialysis or a kidney transplant. Toxin accumulation. EGCG and other compounds in green tea extract can accumulate in the kidneys, especially when the kidneys are already damaged or have reduced filtering capacity. This can lead to inflammation and kidney cell damage. Oxidative stress. Similar to the liver, the kidneys can also be affected by oxidative stress, leading to kidney cell damage and impaired kidney function. Green tea extract can offer some health benefits when used properly and in safe doses. However, the potential for liver and kidney damage from high doses of EGCG is a serious concern. Consumers need to exercise caution, be aware of the potential risks, and always prioritize health safety. It's important to take steps to ensure that all decisions regarding the use of dietary supplements are based on comprehensive information and medical advice. This is the best way to harness the potential benefits of these products without endangering your health. 3. How to use it safely. Now that you know about the potential side effects of green tea extract, let's discuss how to use it safely, which is extremely important for your health. Green tea extract typically contains a compound called epigallocatechin gallate, EGCG, which is known for its powerful antioxidant properties. However, when used in high doses, EGCG can cause serious problems, especially for the liver and kidneys. Safe dosage assessment, research guidance. According to research and medical recommendations, a safe dose of EGCG should not exceed 300 mg per day. Some studies suggest that doses under 600 mg of EGCG per day may be safe, but to ensure maximum safety, the recommended limit is 300 mg. This creates a safety buffer, reducing the risk of damage to the liver or other organs. Considering alternatives and safe use. Natural consumption. Drinking green tea in its natural form is generally safer than taking supplements, as it contains lower and more controlled doses of EGCG. Consuming 2 to 3 cups of green tea daily is typically considered safe for most people. Excessive consumption, such as more than 5 to 10 cups per day, could still pose health risks, particularly for individuals with specific health conditions. Consider your health conditions. Talk to your doctor. If you have health problems or are taking other medications, consult your doctor before starting green tea extract. Your doctor can help you assess the risks and advise you on whether or not you should use the extract. Follow directions for use. Read the product label. Always follow the directions on the product label. This includes not exceeding the recommended dosage and not combining it with other EGCG-containing products without consulting your doctor. Avoid increasing the dosage on your own. Some people may think that increasing the dosage will increase the effectiveness, but this can lead to serious consequences. Increasing the dosage not only does not improve the effectiveness, but can also be harmful to your health. Recognize and monitor unusual symptoms. Warning symptoms. Symptoms such as abdominal pain, yellowing of the skin, a sign of jaundice, unexplained fatigue, or changes in urine color may be signs of liver or kidney damage. If these symptoms appear, stop using the product immediately and consult your doctor. Regular health checkups. People who use green tea extract for a long time should have regular tests to monitor liver and kidney function, helping to detect potential problems early. If you have noticed benefits from using green tea extract and have not experienced any side effects, you can continue to use it, but you need to strictly follow the recommendations on dosage and duration of use. However, if you experience any health warning signs or have underlying health issues, it is best to discontinue use and look for safer alternatives, such as regular green tea, which has a lower EGCG content and is less likely to cause harm. Ultimately, safety and health always come first. Taking supplements, especially those containing potent ingredients like green tea extract, should be done with caution and a full understanding of the potential risks. Always put your health first and seek information from trusted sources and medical professionals before deciding to take any supplements. From what we've shared, it's clear that while green tea and its products offer numerous health benefits, their use, especially in concentrated extract forms, needs careful management to avoid potential risks to the liver and kidneys. To ensure safe use, always consult with a doctor or healthcare professional before starting any dietary supplements. Adhere to safe dosage guidelines and monitor your body for any unusual signs or symptoms. Finally, remember that maintaining a healthy lifestyle, coupled with a balanced diet and regular exercise, is always the best way to protect your health. We hope the information in this video has given you a comprehensive view of green tea extract and how to use it safely. Don't forget to like, share, and subscribe to our channel for more useful information. We look forward to seeing you in future videos. Welcome to our Healthy Care channel, where we'll be discussing the top 10 medications that cause liver damage. The liver plays a crucial role in filtering and processing harmful substances in our bodies. However, certain medications can lead to severe liver damage, and it's important for us to understand them to protect our liver health. In this video, we'll delve into these medications and provide information on the early symptoms of drug-induced liver damage. The last one is the main one, so stay until the end. This will help you recognize and respond promptly to any signs related to your liver health. The 10th medication on our list is the combination of amoxicillin with clavulanate, a widely prescribed antibiotic known for its effectiveness in treating various infections like sinusitis, tonsillitis, pneumonia, and urinary tract infections. Despite its efficacy, there's a significant concern associated with this medication. It has been linked to numerous cases of acute liver injury, a serious condition characterized by sudden liver damage that can have severe consequences if not promptly addressed. Therefore, it's crucial for healthcare professionals to be mindful of this risk when prescribing or administering amoxicillin with clavulanate. Patients should be closely monitored, especially if they're using the medication for prolonged periods or in high doses. They should also be educated about the signs of liver injury and advised to seek immediate medical attention if they experience symptoms such as jaundice, dark urine, extreme fatigue, nausea, vomiting, or abdominal pain, as these may indicate liver problems requiring urgent intervention. The 9th medication known to potentially harm the liver is Diclofenac. While all anti-inflammatories, like ibuprofen and naproxen, carry a slight risk of liver damage, it's relatively rare. However, Diclofenac is particularly notable for its higher risk compared to other anti-inflammatories when it comes to causing liver injuries. Liver damage from Diclofenac can occur weeks or even months after starting to use the medication. Hence, it's crucial to understand that Diclofenac not only affects the kidneys but also poses a risk to the liver. Stay vigilant about any symptoms and consult a healthcare professional if you experience any concerns while using this medication. The 8th medication we'll discuss is Amiodarone, also known as Ancarone, commonly prescribed by cardiologists to manage cardiac arrhythmias. This medication stands out for its effectiveness in significantly improving arrhythmias and even clearing 24-hour Holter records. However, it's essential to recognize that Amiodarone carries one of the highest indexes of side effects among medications. It can impact various organs, including the thyroid, lungs, skin, and yes, the liver as well. Due to this extensive range of potential side effects, its usage has become more restricted compared to the past, reserved for specific cases where the benefits outweigh the risks. While Amiodarone typically doesn't cause acute liver injury, it's important to note that its harmful effects on the liver may take weeks to months to manifest. Healthcare professionals and patients alike should remain vigilant for any signs of liver problems while using this medication and report any concerns promptly to their healthcare provider. The 7th group of medications that can potentially affect your liver are anticonvulsants. Specifically, medications like phenytoin, commercially known as Hydental, and valproic acid, known as Depakote, are noteworthy for their association with liver damage. High dental has been observed to start causing liver injury immediately after initiation of treatment, while the effects of Depakote may become apparent between 1 and 6 weeks into therapy, underscoring the importance of regular monitoring of liver enzymes. In addition to these, carbamazepine and lamotrigine are also recognized for their potential to cause liver injuries, although such occurrences are much less common. Thus, individuals prescribed these anticonvulsant medications should be vigilant about any signs of liver dysfunction and ensure regular liver function tests to monitor their liver health closely. The sixth medication known to potentially cause liver injury is allopurinol. Often prescribed for individuals with elevated uric acid levels or those suffering from gout, especially when dietary modifications alone aren't sufficient to manage the condition. Allopurinol effectively lowers uric acid levels in the body, thereby preventing gout attacks. However, it's crucial to understand that allopurinol can have adverse effects on the liver. Liver injuries associated with allopurinol use can occur rapidly, sometimes within days or weeks after initiating treatment. Hence, patients starting allopurinol therapy should undergo careful monitoring for any signs of liver damage. Regular medical follow-up is essential to promptly detect any issues and adjust the treatment plan as needed. Additionally, patients should promptly report any unusual symptoms that may arise during allopurinol use to their healthcare provider. Despite these risks, it's important to note that allopurinol remains a valuable therapeutic option for many patients with gout or elevated uric acid levels. However, its usage should be managed cautiously, with close attention paid to liver health. The fifth medication of concern is methotrexate, a widely utilized treatment for various conditions including rheumatoid arthritis, psoriatic arthritis, and certain types of cancer. One crucial aspect of methotrexate use is the necessity for continuous monitoring of liver enzymes due to the common occurrence of liver injury associated with this medication. Liver injury induced by methotrexate can span from mild to severe, and in severe cases, may result in significant liver damage if not promptly identified and managed. To mitigate these risks, healthcare providers typically conduct regular liver enzyme tests for patients on methotrexate. These tests serve to promptly detect any signs of liver damage, enabling adjustments in medication or treatment strategies to prevent major complications. Adhering to medical guidelines regarding methotrexate dosage and frequency of use is paramount in minimizing the likelihood of adverse effects, including hepatic ones. In certain scenarios, depending on the patient's health status and response to treatment, healthcare providers may explore alternative therapeutic options to mitigate the risk of liver injury associated with methotrexate. The fourth category of medications that can potentially impact the liver is antifungals. Specifically, fluconazole and itraconazole, commonly employed in the treatment of candidiasis and nail mycosis, are associated with hepatotoxicity in certain susceptible individuals. Given this association, it's crucial for individuals using these medications to treat mycosis to be vigilant about recognizing signs of hepatic toxicity, as mentioned earlier. Prompt identification of such symptoms can facilitate timely intervention and management to mitigate the risk of liver damage associated with antifungal therapy. The third group of medications that can impact the liver are antipsychotics, specifically risperidone and quetiapine, marketed under the name Seroquel. These antipsychotic medications are not only utilized in the treatment of psychoses but are also employed for cases of refractory depression, which refers to depressions unresponsive to conventional treatment. Both risperidone and quetiapine carry the potential to cause liver damage, primarily through a process known as drug-induced cholestasis. This condition occurs when there's an interruption or reduction in the flow of bile from the liver, crucial for fat digestion and waste elimination. When medications like risperidone and quetiapine interfere with this process, bile can accumulate in the liver, leading to potential hepatic damage. Therefore, patients undergoing treatment with these medications should undergo careful monitoring for any signs of liver problems to ensure early detection and intervention. The second medication known to potentially affect the liver is methyldopa. Methyldopa is commonly prescribed to manage high blood pressure and is particularly favored for its safety, being the most prescribed medication for pregnant women with hypertension. Despite its overall safety profile, methyldopa has been associated with potential liver damage. As such, its use is not recommended for individuals with pre-existing liver conditions such as fibrosis or cirrhosis. It's important to note that adverse effects on the liver can manifest up to 12 weeks after initiating treatment with methyldopa. Regular monitoring of patients using this medication is crucial to promptly detect any signs of liver impairment. This monitoring helps prevent deterioration and ensures that hypertension treatment does not inadvertently harm liver health. Patients with a history of liver diseases should engage in discussions with their healthcare providers to explore safer alternative treatment options. The top drug on the list is paracetamol, which is widely recognized as the leading cause of drug-induced liver failure. Typically, liver injury isn't triggered by the standard dosage but rather by excessive doses. Unfortunately, due to its widespread availability, some individuals misuse paracetamol, taking more than the recommended amount. For instance, instead of adhering to the appropriate dosage for a headache, they might ingest 3 tablets at once, repeating this overdose pattern. It's crucial to underscore that when taken as directed, paracetamol is safe. Doctors routinely prescribe it to infants to alleviate fever or pain without encountering issues. However, surpassing the recommended dose can be perilous. Shockingly, more than a third of liver failure cases attributed to medications are linked to paracetamol. An overdose of paracetamol can precipitate acute liver failure, which carries a high mortality rate and often necessitates a liver transplant if the organ fails to regenerate itself. Unlike the kidneys, where hemodialysis can sometimes reverse renal failure temporarily, the liver typically requires a transplant once compromised. Moreover, factors like alcohol consumption, genetic predisposition, and concurrent intake of other medications on the list can heighten the risk of liver injury. Liver damage from paracetamol typically initiates within 1 to 3 days following ingestion, with symptoms manifesting 2 to 4 days later. Fortunately, an antidote for paracetamol overdose exists: acetylcysteine, also known as fluomucil, which serves as an expectorant and is used for certain cases of OCD and trichotillomania. This antidote proves effective in safeguarding the liver against paracetamol overdose. However, if you've exceeded the recommended dosage, it's imperative to seek immediate medical attention at an emergency room and explain the situation to the doctor, rather than risking the need for a liver transplant. It's essential to recognize that just because a medication isn't listed here doesn't mean it can't cause liver damage. Vigilance and adherence to prescribed dosages are paramount to protecting liver health. The roster of medications carrying hepatotoxic potential is expansive, encompassing antiretrovirals, vitamins like niacin, various antibiotics, supplements, and even herbal teas, a topic explored in a separate video. Given the liver's pivotal role in bodily functions, any malfunction can have far-reaching consequences. Thus, exercising extreme caution when using medications is paramount to prevent drug-induced hepatitis and, in severe instances, fulminant hepatitis. Fulminant hepatitis represents a grave complication affecting a notable fraction of individuals with acute drug-induced hepatitis, often characterized by symptoms like jaundice and yellowing of the skin. Shockingly, among these cases, only approximately 20% survive without the necessity of a liver transplant. This underscores the critical importance of vigilant medication use and prompt medical intervention to safeguard liver health and overall well-being. To learn more about this topic, please like the video and subscribe to my Healthy Care channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy. Hello everyone, welcome back to our channel. Did you know that your feet can be a hidden window into the health of your liver? Most people don't realize that this vital organ, which works tirelessly to detoxify your body, manage nutrients, and regulate many critical functions, can send out warning signs through the most unexpected parts of your body, including your feet. In this video, we're going to take you on a deep dive into 12 subtle yet important signals that your feet might be giving you when your liver is under strain or not functioning as it should. From persistent swelling and unusual sensations to changes in skin color and texture, these symptoms can act as early indicators of liver damage. The liver is responsible for a huge range of processes that keep your body in balance, but when it's overloaded or begins to deteriorate, these processes break down, and symptoms often show up far from where you'd expect, like your feet. Understanding these signs can be the key to catching liver issues before they escalate into more serious health problems. Whether it's due to lifestyle factors, toxins, or underlying conditions, identifying liver-related symptoms early on gives you the power to make changes that protect your long-term health. Stay tuned as we explore each of these 12 foot-related warning signs in detail, explain what they mean, and offer insights on how to take action. If you've ever wondered what your feet might be trying to tell you about your internal health, especially your liver, this video is a must-watch. Don't miss the chance to learn how paying attention to these signs can help you safeguard one of the body's most vital organs. 1. Foot odor. Foot odor may be a sign of an underlying issue with your liver. When your liver becomes overwhelmed or diseased, it can effectively filter out toxins from the body, leading to unusual body odors. For example, people with liver disease may notice a sweet, fruity odor or an ammonia-like smell on their breath or skin. This occurs because the liver is responsible for processing metabolic waste, and when it's not functioning properly, toxins such as ammonia build up in the bloodstream. Foot odor can also be exacerbated by bacterial imbalances, which are often linked to impaired liver function. If you're concerned about your foot odor, it's essential to consult with a healthcare professional who can evaluate your liver function and identify any underlying issues. Poor circulation, often linked with liver disease, can contribute to the buildup of waste products, making foot odor more pronounced. 2. Jaundice. Jaundice is a condition characterized by the yellowing of the skin and eyes due to high levels of bilirubin in the blood. When the liver is unable to properly process bilirubin, it can build up in the bloodstream, leading to this visible sign of liver dysfunction. Jaundice can occur throughout the body, but it can also manifest in specific areas such as the feet. Additionally, jaundice can be associated with a feeling of fatigue, unexplained weight loss, and dark-colored urine, all of which may indicate a more serious liver issue. If you notice a yellowish discoloration on your feet, it's essential to seek immediate medical attention, as it can be a symptom of various liver diseases, including hepatitis and cirrhosis. This condition can also be linked to bile duct obstructions, which prevent the proper flow of bile, leading to toxin accumulation in the body. Liver health problems that cause jaundice may also result in persistent itching or even swelling in other parts of the body. 3. Ecchymosis. Ecchymosis, or bruising, is a common phenomenon that can appear on the skin, but have you ever wondered why you might be experiencing these purple, black, or blue patches on your feet? It may be more than just a minor injury. In fact, ecchymosis can be an important warning sign of liver problems. When the liver is not functioning properly, it can affect blood clotting, leading to easy bruising and the formation of these discolorations on the skin. People with chronic liver conditions often suffer from deficiencies in vitamin K, an essential nutrient involved in blood clotting, further increasing their risk of bruising. Additionally, liver disease can lead to a decrease in the production of clotting factors, proteins made by the liver that are essential for preventing excessive bleeding. When the liver is compromised, it can cause blood to accumulate under the skin, resulting in these bruise-like patches. In some cases, this may be accompanied by fatigue or other signs of liver failure. 4. Burning sensation. Burning sensation in your feet might surprise you as being related to liver health. While burning feet can be caused by various factors, such as nerve damage or poor circulation, it's essential to consider the possibility of an underlying liver issue. This is because liver diseases such as hepatitis or cirrhosis can cause a buildup of toxins in the body, which can manifest as a burning sensation in different parts of the body, including the feet. The toxins that accumulate due to poor liver function can irritate nerve endings, leading to neuropathic pain, which often manifests as burning or tingling in the extremities. Peripheral neuropathy, a condition often associated with liver dysfunction, can result from high levels of toxins in the bloodstream, particularly ammonia, that damage the nervous system. This condition can also cause numbness or a pins and needles feeling in the feet, making walking or standing uncomfortable. 5. Spider veins. Spider veins, though they may appear minor, could be an indicator of a more serious health condition like liver dysfunction. Conditions such as cirrhosis can lead to increased blood pressure in the portal vein system, known as portal hypertension. This occurs because the damaged liver tissue obstructs normal blood flow through the liver. As a result, blood backs up into the portal vein, increasing pressure within this vessel. To accommodate this increased pressure, blood finds alternative pathways through smaller veins, leading to their dilation and enlargement, causing spider veins to develop. Spider veins can also be a sign of impaired estrogen metabolism, which the liver normally helps to regulate. When the liver is diseased, hormonal imbalances can occur, contributing to the development of these visible vein patterns. Additionally, liver disease can cause fluid retention, increasing pressure on veins and worsening the appearance of spider veins. 6. Staining on feet. Staining on feet may seem mysterious at first, but these unexplained marks could be a sign that your liver is struggling to eliminate waste properly. When the liver isn't functioning correctly, it can't filter out bilirubin, a yellow pigment produced during the detoxification process, efficiently. As a result, bilirubin levels can rise, causing yellowish or brownish staining on the skin, including the feet. This buildup of bilirubin is often a sign of liver problems such as liver disease or damage to the liver's filtering mechanism. In some cases, these stains may also be accompanied by a thickening of the skin or changes in skin texture, which are often seen in individuals with advanced liver disease. Staining may also signal a disruption in red blood cell turnover, which is another process the liver regulates. This can lead to excess bilirubin and iron deposits, further discoloring the skin. 7. Itchy soles. Itchy soles are a common complaint, but did you know that persistent itchiness on the soles of your feet can be linked to liver problems? An overloaded or damaged liver may not be able to filter out toxins efficiently. Liver diseases such as cirrhosis, hepatitis, and bile duct obstruction can cause a buildup of toxins in the body, which can manifest as itchiness in various parts of the body, including the soles of the feet. This occurs because the liver is responsible for filtering out toxins, and when it becomes overwhelmed or damaged, toxins can accumulate and irritate the skin. Itchy soles may also be linked to cholestasis, a condition in which bile flow from the liver is reduced, leading to a buildup of bile acids in the bloodstream that irritates the skin. This condition is especially prevalent in people with liver diseases like primary biliary cholangitis. 8. Purple bumps on the skin. Purple bumps on the skin, known as purpura, are characterized by the presence of purple or red spots on the skin caused by bleeding under the skin. When the liver is not functioning properly, it can impact blood clotting, leading to easy bruising and the formation of these flat purple bumps. Specifically, liver dysfunction can cause changes in platelet function and blood vessel permeability, making it easier for blood to leak into the skin and cause purpura. Purpura may also indicate that the liver is struggling to process proteins necessary for clotting, causing capillaries to break more easily. This condition can also be a sign of advanced liver cirrhosis, where the liver's inability to filter blood and produce necessary clotting agents is severely compromised. In some cases, purpura may be associated with more severe bleeding issues, requiring immediate medical attention. 9. Right foot swelling. Right foot swelling may seem unrelated to the liver at first, but swelling in your right foot can actually be a sign of liver dysfunction. The liver plays a crucial role in maintaining fluid balance in the body, and when it's not functioning properly, it can lead to a condition called right-sided heart failure. This increased pressure can cause fluid to back up in the veins and eventually accumulate in the lower extremities, including the right foot, causing it to swell. Swelling in the feet, also known as edema, is often a sign of fluid retention, which occurs when the liver is unable to produce enough albumin, a protein that helps keep fluid in the bloodstream. Without adequate albumin, fluid leaks into surrounding tissues, particularly in the feet and legs. Liver disease can also cause ascites, an accumulation of fluid in the abdomen, which can further contribute to swelling in the lower body. 10. White or curved nails. White or curved nails may signal liver dysfunction. At any stage of your life, if you observe white nails or nails becoming curved, it can be a warning sign. Specifically, white or curved nails can be a sign of an unhealthy liver, leading to a condition called Terry's nails. This condition is a recognized symptom of liver disease, often seen in patients with cirrhosis or chronic hepatitis. Recognizing this subtle warning sign allows individuals to take proactive steps to address liver health and potentially prevent more serious complications. In addition to Terry's nails, liver dysfunction may cause the nails to become brittle, ridged, or discolored, all of which reflect poor protein synthesis, a function of a healthy liver. These nail changes can also occur alongside other symptoms such as fatigue, jaundice, or swelling. 11. Cracked heels. Cracked heels, often overlooked, can be more than just a cosmetic concern. Despite their seemingly harmless appearance, cracked heels can be a symptom of a more serious underlying issue. Liver diseases such as cirrhosis or hepatitis can cause the liver to become overwhelmed and unable to filter toxins effectively. As a result, toxins can accumulate in the body, leading to a variety of skin issues, including dryness and cracking of the heels. Specifically, impaired liver function can lead to changes in skin moisture levels, making it more prone to dryness and cracking. Poor circulation and reduced hydration, both of which can be linked to liver disease, may further exacerbate the problem, causing the skin to become rougher and more prone to cracks. Addressing the root cause, liver health, may not only heal the heels but also improve overall skin texture and hydration. 12. Toenail fungus. Toenail fungus may have implications that extend beyond its physical manifestation. Research suggests it could be a sign of impaired liver function, which can lead to serious health complications. When the liver is not functioning properly, it fails to produce bile, allowing bacteria to overgrow and disrupting the balance of microbes in the small intestine. This can lead to conditions like small intestinal bacterial overgrowth, SIBO, and an increased risk of fungal infections like toenail fungus. A healthy liver is crucial for maintaining a balance of microbes, preventing the overgrowth of certain bacteria or fungi, and ensuring overall gut health. Liver impairment may also decrease immune function, making it more difficult for the body to fight off fungal infections. Addressing liver health can help restore the body's natural defenses and prevent recurring fungal infections. Understanding the factors that contribute to liver damage is essential for both prevention and recovery. Excessive alcohol intake is a major cause of liver diseases such as fatty liver, hepatitis, and cirrhosis, all of which significantly compromise liver function. With over 20% of adults in the U.S. affected, excessive drinking leads to the destruction of liver cells, hinders regeneration, and disrupts metabolic processes, which may result in irreversible scarring and ultimately liver failure. Reducing or eliminating alcohol consumption can greatly lower the risk of liver damage and improve overall health, making it a critical step toward a healthier lifestyle. A poor diet can also contribute to liver damage. Diets high in sugar, refined grains, and processed carbohydrates can lead to non-alcoholic fatty liver disease, NAFLD, which affects millions worldwide and is frequently linked to weight gain. Research shows that up to 80% of individuals with NAFLD are either overweight or obese. High consumption of added sugars, refined carbohydrates, and processed foods contributes to insulin resistance, inflammation, and oxidative stress, which can all damage the liver and heighten the risk of NAFLD. Adopting a well-balanced diet rich in whole foods, fruits, vegetables, whole grains, lean proteins, and healthy fats can mitigate the risk of NAFLD and enhance liver health. Medications and environmental toxins are also significant threats to liver health. For instance, an overdose of acetaminophen can lead to severe liver damage, even resulting in liver failure. Additionally, exposure to industrial chemicals like pesticides and herbicides has been associated with liver inflammation and scarring. It's crucial to adhere to recommended medication dosages and consult healthcare providers to minimize potential risks to the liver. Reducing exposure to environmental toxins, such as using non-toxic cleaning products and avoiding pesticides, can further protect liver function. Several measures can be taken to detoxify and support liver health. Incorporating liver-friendly foods such as lemons, garlic, and cruciferous vegetables into your diet can enhance detoxification by activating liver enzymes and aiding their natural cleansing processes. These foods encourage the liver to eliminate toxins from the body, boosting overall health. A powerful liver detox drink can be made by combining apple cider vinegar, fresh lemon juice, and black seed oil with water. This mixture helps balance blood sugar levels and supports fat breakdown in the liver, assisting in detoxification and promoting liver health. It's equally important to cut out substances that overwork your liver, including alcoholic beverages, sugary foods, and processed grains, as they contribute to inflammation and impair liver function. Reducing or eliminating these from your diet can have a significant positive impact on liver health. Additionally, using supplements such as purified bile salts or digestive enzymes can improve bile flow and fat metabolism, helping to neutralize toxins and support liver health. These supplements may be particularly beneficial for those with digestive problems or a history of liver dysfunction. Lastly, adopting intermittent fasting, where you consume your nutrients within a 5-hour window, can reduce the liver's workload and give it more time for filtration and repair during the remaining 19 hours. By following this approach, you can significantly enhance liver function, reduce inflammation, and promote overall well-being. We hope the information provided helps you recognize early warning signs of liver issues through changes in your feet, allowing you to take action before problems escalate. Your health is important, and understanding these subtle signals can make a big difference in maintaining overall well-being. If you found this video helpful, please give it a thumbs up and share it with your friends and family to spread awareness. Also, make sure to subscribe to Healthy Care for more insightful content on how to take care of your body, prevent illness, and maintain a healthy lifestyle. Stay healthy, stay informed, and we'll see you in the next one. Welcome back to Healthy Care, where we provide valuable health information to help you live a healthier life every day. Today, we'll be exploring some symptoms that can appear at night, which many people often overlook but are directly related to liver disease. These signs can disrupt your sleep and affect your daily quality of life. Recognizing and addressing these symptoms in a timely manner can help improve your overall health and ensure your liver functions properly. Did you know that our liver keeps working even while we sleep? While you enjoy your rest, this organ continues to filter toxins and keep your body running smoothly. However, when the liver encounters problems, certain signs of liver disease may become most noticeable at night without you even realizing it. These symptoms are often ignored, but they play an essential role in signaling your overall health condition. The liver is a vital organ, yet it's one of the most vulnerable if we don't take care of it. Liver issues often progress silently, with symptoms only becoming apparent during rest at night. If you often experience insomnia, discomfort, or unusual health changes at night, it might be time to take a closer look at your liver's health. In today's video, we'll help you identify the common nighttime signs of liver disease and share useful tips to manage them and protect your health. Let's get started on the journey of taking care of your liver health and improving your sleep. Number 8. Dark urine. Waking up to find your urine is a dark brown, or tea color, instead of the usual pale yellow, can be alarming and may indicate an underlying health issue, such as liver disease. This can be quite unsettling, especially if it happens frequently. Dark urine can be accompanied by other symptoms like a strong odor, fatigue, or abdominal discomfort, making it even more concerning. Dark urine in the context of liver disease is typically due to the buildup of bilirubin, a yellow compound that forms as red blood cells break down. Normally, the liver processes bilirubin, which is then excreted in bile and removed from the body through the digestive tract. When the liver is damaged, it cannot process bilirubin effectively, leading to its accumulation in the blood. This excess bilirubin is then excreted through the kidneys, causing the urine to appear dark. Liver disease can also cause dehydration, which concentrates the urine and makes it appear darker. This is particularly noticeable when you haven't had enough fluids, such as first thing in the morning. Certain medications or toxins that affect liver function can also cause dark urine. If the liver is struggling to filter these substances out, they can change the color of your urine. In severe cases, dark urine may contain blood due to complications of liver disease such as bleeding disorders. This requires immediate medical attention. It's crucial to talk to your doctor if you notice dark urine, especially if it's persistent. They can conduct tests to determine if liver disease is the cause and suggest appropriate treatments. Limit exposure to environmental toxins and chemicals that strain your liver. This includes avoiding excessive alcohol consumption and being cautious with over-the-counter pain relievers and herbal supplements. Number 7. Waking up with nausea. You're in the middle of a deep sleep when suddenly you wake up with a queasy, unsettled feeling in your stomach. You might feel like you're on the verge of vomiting, and the sensation can be accompanied by a sour taste in your mouth or excessive salivation. This discomfort can make it hard to get back to sleep, leaving you tired and frustrated. One of the liver's primary roles is to filter out toxins from the blood. When the liver is not functioning properly, these toxins can accumulate and affect various bodily functions, including digestion. This buildup of toxins can lead to feelings of nausea, particularly at night. Liver disease can disrupt bile production and flow, leading to digestive issues such as indigestion or acid reflux, which can cause nausea. Liver disease can alter the balance of hormones in your body, including those that regulate digestion and appetite. These hormonal changes can contribute to nausea. Your doctor might recommend medications or supplements to help manage nausea. Always follow their advice for safe and effective treatment. Using extra pillows to elevate your head can help prevent acid reflux, which can cause nausea during the night. Before we cover the next symptom, don't forget to subscribe to our channel to stay updated with the latest health tips and advice. Number 6. Night sweats. If you're waking up in the middle of the night drenched in sweat, your pajamas sticking to your skin, and your sheets damp, you may want to look into why. You might feel clammy and uncomfortable, needing to change clothes, or even shower to feel dry again. These episodes can range from mildly annoying to severely disruptive, making it hard to get a good night's rest. Night sweats in the context of liver disease can be attributed to several factors. The liver is responsible for filtering toxins from the blood. When it's not functioning properly, these toxins can accumulate in your system, potentially causing your body to react with night sweats. Liver disease can disrupt the balance of hormones in your body, including those that regulate temperature. This disruption can lead to excessive sweating, particularly at night. Chronic liver disease can sometimes be associated with low-grade infections or inflammation, which can cause your body to produce sweat in an attempt to regulate temperature. The liver plays a key role in metabolism. Liver disease can alter metabolic processes, leading to changes in body temperature regulation and causing night sweats. It's important to speak with your doctor to determine if liver disease is the cause of your night sweats. They can run tests to diagnose liver problems and recommend appropriate treatments. Eating a balanced diet can support liver health. Focus on foods that are rich in antioxidants, vitamins, and minerals. Avoid alcohol and limit consumption of fatty, fried, and sugary foods. Spicy foods and caffeine can trigger sweating. Try to avoid these, especially in the evening, to reduce the likelihood of night sweats. Number 5. Restless leg syndrome. Restless leg syndrome can be a real nighttime nuisance, and it might surprise you to know that it can be linked to liver disease. Imagine settling into bed, ready for a good night's sleep, and suddenly feeling an uncontrollable urge to move your legs. It's like having ants in your pants, except they're actually in your legs. These sensations can range from a mild tickle to an aching or even a creepy crawly feeling that just won't quit. The result? Tossing, turning, and a serious case of the sleepless blues. So why does this happen? Liver disease can cause peripheral neuropathy, a condition where the nerves outside your brain and spinal cord are damaged. When your liver isn't functioning properly, toxins can build up in your bloodstream, which can harm these peripheral nerves. This nerve damage sends jumbled signals to your brain, tricking it into thinking your legs need to move constantly to relieve the discomfort. If RLS is keeping you up at night, it's important to address it. Ensure you're getting enough nutrients, particularly those that support nerve health, like iron, magnesium, and B vitamins. Avoid alcohol, as it can worsen liver function and nerve damage. Keep a regular sleep schedule and create a calming bedtime routine. Reducing stress and practicing relaxation techniques can also help. Drink plenty of water throughout the day to help your body flush out toxins and maintain overall health. Subscribe to this channel if you're finding this video helpful. Thank you. Number 4. Frequent urination. Next up in our nocturnal adventures, frequent urination. Finding yourself sprinting to the bathroom multiple times during the wee hours. It might be more than just an annoying disruption to your sweet dreams. It could be a signal from your body about liver issues. Liver disease can cause fluid retention and diuretic effects, leading to increased urine production, especially at night. To manage this, limit your fluid intake in the evening and avoid caffeine and alcohol. If this sounds like your typical night, it might be time to consult your healthcare provider and keep your liver health in check. Number 3. Nighttime muscle cramps. Nighttime muscle cramps can be more than just a painful nuisance. They might be a signal of an underlying liver issue. It can feel like being jolted awake by a sudden intense cramp in your leg. The muscle tightens and contorts painfully, leaving you rubbing and stretching in a desperate attempt to find relief. These cramps can last from a few seconds to several minutes and can recur multiple times throughout the night, making restful sleep seem impossible. So, how does liver disease play into this? The liver is essential for maintaining a balance of electrolytes and minerals in your body, which are crucial for proper muscle function. When the liver is not functioning correctly due to disease, it can lead to imbalances in these electrolytes, such as calcium, potassium, and magnesium, which can cause muscles to cramp and spasm. Additionally, liver disease can result in poor circulation and reduced oxygen supply to the muscles, further contributing to the frequency and severity of muscle cramps. Ensure your diet includes foods rich in essential minerals like potassium, magnesium, and calcium. Bananas, leafy greens, nuts, seeds, and dairy products can help maintain these levels. Avoid excessive alcohol and salty foods as they can disrupt your electrolyte balance. Dehydration can exacerbate muscle cramps. Drink plenty of water throughout the day and consider keeping a glass of water by your bedside in case you wake up thirsty during the night. Gentle stretching exercises before you go to sleep can help relax your muscles and reduce the likelihood of cramps. Focus on your legs and feet, where cramps are most common. If you do experience a cramp, massaging the affected muscle and applying warmth, like a warm towel or heating pad, can help alleviate the pain and relax the muscle. Number 2. Insomnia. Imagine lying in bed, staring at the ceiling and counting endless sheep with no sign of sleep in sight. Your mind races, your body feels restless, and as the hours tick by, you get more and more frustrated. Even when you do manage to drift off, it's a fitful sleep that leaves you feeling exhausted the next day. So, what's the connection between liver disease and insomnia? The liver plays a crucial role in detoxifying your blood and managing various metabolic processes. When liver function is impaired, toxins can build up in the bloodstream and affect brain function. This can lead to a disruption in your body's natural sleep-wake cycle, making it difficult to get a good night's sleep. Additionally, liver disease can cause imbalances in hormones and neurotransmitters, such as melatonin and serotonin, which are critical for regulating sleep. These imbalances can further contribute to insomnia. If insomnia is becoming your nightly nemesis, here's what you can do. It's essential to see your doctor if you're experiencing persistent insomnia. Blood tests can help determine if liver disease is the underlying cause. Your healthcare provider can then recommend appropriate treatments. Establishing a calming pre-sleep routine can help signal to your body that it's time to wind down. This might include activities like reading, taking a warm bath, or practicing gentle yoga or meditation. Try to go to bed and wake up at the same time every day, even on weekends. Consistency reinforces your body's sleep-wake cycle. The blue light emitted by phones, tablets, and computers can disrupt your body's production of melatonin, making it harder to fall asleep. Aim to turn off screens at least an hour before bedtime. Make your bedroom a haven for sleep. Keep it cool, dark, and quiet, and invest in a comfortable mattress and pillows. Before we cover the next symptom, don't forget to like and subscribe. Number 1. Itchy skin. Picture this: you're cozied up in bed, drifting off to sleep, and suddenly you're hit with an intense urge to scratch. It's not just a mild itch, it's an unrelenting need to scratch that keeps you awake and frustrated. This itchiness can be localized or widespread and often feels more intense at night, disrupting your precious sleep. So what's the deal with this nocturnal itching? Liver disease can cause a buildup of bile salts in your bloodstream. Normally, your liver processes these bile salts, and they help with digestion. However, when your liver is compromised, it can't filter out these substances efficiently. As a result, these bile salts accumulate and deposit under your skin, causing that relentless itch. If itchy skin is becoming a nightly struggle, here's what you can do. Use a good quality moisturizer to keep your skin hydrated. Dry skin can exacerbate itching, so apply lotion generously, especially after bathing. Hot water can strip your skin of natural oils and worsen the itching. Opt for lukewarm showers and gentle, fragrance-free soaps to keep your skin calm. Over-the-counter anti-itch lotions or creams containing ingredients like menthol or camphor can provide temporary relief. Antihistamines might also help, but consult with your healthcare provider before taking any new medication. Keeping your bedroom cool can help reduce itching. Use a fan, lightweight bedding, and wear loose, breathable pajamas to keep your skin comfortable. In some cases, medications that reduce bile salts or address liver function may be necessary. Your healthcare provider can advise you on the best course of action. For more information. And there you have it, those are the 8 crucial signs of liver disease that can appear at night. It's vital to understand that while liver disease can often remain silent during the day, nighttime can bring out a host of symptoms that should never be overlooked. Whether it's persistent itching, muscle cramps, dark urine, or insomnia, these indicators can tell us a lot about what's happening inside the body, particularly with the liver. Recognizing these signs early is essential for managing not just liver health but your overall well-being, as liver issues can have wide-ranging effects on everything from digestion to sleep quality and energy levels. If you've noticed any of these signs in your own life, it's essential to speak with a healthcare provider to get proper evaluation and advice. Early detection can lead to more effective treatments and help you maintain a better quality of life, including restful sleep. Along with regular medical checkups, making simple lifestyle changes like eating a healthy diet, staying hydrated, and avoiding excessive alcohol can go a long way in supporting your liver health. We hope you found this video helpful in understanding some of the more hidden symptoms of liver disease. If you did, don't forget to give it a thumbs up, leave a comment, and share it with others who might find this information useful. Also, Make sure to subscribe to our channel for more health tips, advice, and updates that can help you stay informed about your well-being. Thank you for watching, and we'll see you in the next video.